Hi everyone, my name is Daneshmand and welcome to the Love and DNA series. As you all know, I started these series to highlight individuals or organizations who are doing something positive in our society. And of course, we're going to do a segment on Miracle Babies, an organization that was started in 2010 by me and a lot of volunteers to provide financial assistance to families who have sick newborns in the neonatal intensive care unit. Well, by 2020, with COVID, we started transitioning what we're doing, and we started providing transportation services, which you'll hear about from our executive director and other team members. But I'm very excited also for the launch of a new program called My Brain and My Baby, because what was missing with Miracle Babies, the transportation service, was we were making sure every mom is united with their sick newborn. But what was missing was the mental health of a mom. As we all know, depression, anxiety is on the rise, and with COVID, unfortunately, these numbers have really made a lot of patients struggle. We are, as obstetrician gynecologists, as perinatologists, we're obligated to screen our patients when they're pregnant and immediately in the postpartum period. But there's no one to send them to because psychologists, therapists, they're inundated by the number of patients, by the number of referrals. There's stigma associated with it. There's health plan authorization issues. There's money. Some people only charge cash. If you have Medicare, Medi-Cal, some people don't accept those insurances. So I'm honored to be here with Sheila Kubota, who's the director of My Brain and My Baby, the program that we're so excited about, that we're going to be hopefully launching in May of this year in 2022. Sheila, I've known you for many years, working at a prior institution that I used to deliver care to patients at, and I'm so excited that you're part of this team. Tell me a little bit about My Brain and My Baby.
It is going to be a free therapy service for high-risk mothers who we know that high-risk pregnancies are a higher risk for perinatal mood and anxiety disorders, also known as maternal mental health disorders. And so they are going to be the ones that we focus our services on. So we're going to be doing some short-term therapy and then some group therapy and a lot of education out into the community, because we're finding that there are a lot of people who do not know about maternal mental health issues. And several people in our short time doing some community needs assessment here locally in Southern California, they don't even know that it starts during pregnancy. I think so many people have that misconception that it's just postpartum, and then also that it's just a few months and then it goes away. And we know that that is not the case at all, particularly with the population that's already being served by Miracle Babies. The NICU, that's a huge risk factor for getting maternal mood and anxiety disorders. But then coupled with high-risk pregnancies, any other traumas you may have experienced in the past, if you've had mental health disorders in the past, all of that and so many other factors can just increase your risk for any kind of maternal mood or anxiety disorder. So there's so much work to be done, and we're lucky that you guys have been able to find funding to have this service be free to the moms that we'll be able to provide.
I'm excited. We're behind, as you know, right? We're really behind. And can you share some statistics with us as far as the number of women that are struggling with depression, with anxiety, not only just regionally in California, but also just nationwide?
So nationwide, the studies have indicated that about 800,000 women are suffering from this. And only, over 75% of them are not seeking treatment. I think there's several issues there at play. Some you already mentioned, stigma, people who are able to do screenings don't know what services to provide. I think for mental health, it's still scary for people who are focused more on the medical side. I think it's always hard to open that can of worms of mental health if you don't know what to say to them or what services you can turn the family over to. So some just won't even go there, which is such a disservice.
It's such a disservice. And I read 1 in 5 women are struggling with depression and anxiety. We have about 4 million Americans, pregnant, delivering each year. So 800,000, women are struggling with depression and anxiety. It's sad to me that we have such little emphasis on this. People talk a big game, they talk constantly about this, but there's very little action behind it. Yes. Tell me about what are the plans for My Brain and My Baby moving forward in the immediate period and also long term?
So immediately, I think one thing that we've identified is if you're able to talk to mothers about it during pregnancy, then just providing them the awareness alone. So lots of people can do this beyond us. Anybody listening can just do this, is knowing that there is a risk during your pregnancy and what to look for thereafter. So there are lots of studies that show just some intervention during the pregnancy can reduce the amount of perinatal mood and anxiety disorders postpartum by 33%. And so if we can just prevent them from even occurring, I think that's huge. So we're starting in the pregnancy with moms that we know to be a high-risk category with their high-risk pregnancies. And then with giving them some of the education about what to look out for if they're already experiencing those signs and symptoms, giving them that short-term therapy and support. And then we're going to be linking them to providers in the community if they need ongoing support, because we know that a lot of this will turn into something postpartum. And so we don't want to drop them there. We want to get them already into the services, connected with a provider so they have that support moving forward. And then hopefully be able to show some of the benefits of this program so that other people can replicate it and we can help others throughout the nation know, starting it during pregnancy, then that's that much less concerns that people are going to have to follow through with postpartum when there's already maybe a premature baby, already a baby with other siblings at home, socioeconomic status. There's so many things that can just increase the difficulties of mental health, and what that then does for the family thereafter is huge. And so we talked earlier about the 1 in 5 statistic of moms, and if you are of low socioeconomic status or a woman of color, it's 3 out of 5. So your likelihood is so much, it's increased dramatically. And then during the pandemic, they've seen that it's tripled the amount of maternal health issues that have come up for mental health. So, I think there was a lot of studies initially that people were like, oh, women are less stressed with the pandemic because they're home and they're resting. I think that was just a very short-sighted time because so many other mental health providers in the community have not been able to meet the demand. And so with us reducing barriers in the beginning, free service, it doesn't matter what insurance you have, we're going to provide some of that service for you and then link you to the community providers that you can carry on with ongoing, and hopefully then it'll be easier for them in the long run.
And hopefully long term, be able to provide mental health services to all women, pregnant women with depression and anxiety.
Yes.
I read that we have a significant number of women struggling with this. Less than 25% are actually getting treatment.
Yes.
And this accumulates to about a $14+ billion cost annually to the US.
Yep.
We always talk about epigenetics, we always talk about DNA and the environment, and I always explain to my patients that, the environment for your child when you're pregnant is mom. Right? How does depression, anxiety impact the fetus and the newborn?
Oh, I wish it didn't, but it does.
Yeah.
And there are so many aspects of the baby's development, small for gestational age, so they're going to be smaller size. And then premature birth, right? Which is a huge piece of what Miracle Babies is about, is helping the families during that time. So small for gestational age, premature birth, and then the long-term consequences of the moms that have unaddressed mental health issues. They're not going to be able to bond and attach with their baby. The babies are looking to us for those cues, us as in the parent, the mom, and if they're not able to get that, then that stunts their brain development and then their developmental potential longfold. They're at higher risk for health issues. There's more frequent visits to the emergency department for an anxious mom who's just not sure and doesn't have the confidence. The children are more likely to have mental health issues, and then the cycle continues because we know mental health issues just span so many different aspects of your life. You're not able to hold a job, you're not able to be present, and then the kids have issues with behavior in school. You're not able to just meet some of those basic needs if it gets to a debilitating point. And I think there's a lot of nuances with mental health where sometimes people just don't even realize it's there until it gets to a point where you're having, psychosis, or you're having such extreme panic attacks that you can't go out, you can't help your child learn something new. And so there's just such far reaches in society that this can impact. And if we can prevent that from even occurring, then the baby has that much more developmental potential thereafter and can break some of the cycles. I just see this reaching so many aspects of life.
I know that as adults, when we seek therapy, whether we're depressed, whether we're stressed out, or any kind of midlife transition or crisis that we're facing, a lot of times therapists ask about our childhood years. Mm-hmm. I think there needs to be a lot more focus on the pregnancy period and the immediate time after that, because a lot of things, unfortunately, that all the negative things that we encounter is a lot of it has to do with those early childhood years, because again, the DNA is also very impressionable. That's why, again, the Love and DNA series, right? DNA in very early stages of first weeks of life has already determined the personality, the hair color, our sexual orientation, mm-hmm. all those things. But the love and nurture of a mom and a parent and a caregiver is crucial mm-hmm. to that child's development. It changes the function of that child's DNA. So we can actually reduce many of these issues that we see with our children by making sure that, again, a mom is present mentally there. So that's why, what you're doing is so important. I have so much respect really for the line of work you do and your compassion and respect towards our patients. As far as the, federal, state, and local level, I know you've been here for just a few weeks, maybe I think 2 weeks now, right? Oh my God, and you're already attending advocacy mm-hmm. groups to see what you can do more for our patients nationwide. Can you tell us share with me a little bit what your goals are with that?
So there are wonderful organizations that exist to help us understand better the magnitude of this issue and why it's monumentally important. And so Maternal Mental Health Leadership Alliance, as well as 2020 Mom and some other groups have gotten together to help create advocacy materials. And we were able to do a Maternal Mental Health Advocacy Day where we met with staffers for Congress people. And so I was able to speak directly to my personal story. I actually do have my own personal story of maternal mental health. And partly that's what drives my passion for it. And we were able to share the different acts and legislation that we want people to co-sponsor, the Into the Light Act, Moms Matter Act, and that will then help provide funding on a federal level for all these agencies that are in the community to have more of a focus on maternal mental health. Not only do people not realize that there is maternal mental health issues from pregnancy and then thereafter it continues, there's a lot of focus on the child, which is wonderful. But again, like you're saying, if we don't have that mother and the focus on the mother, which I think is easily forgotten at times, we wouldn't even have to be working on redirecting the child and some of their acting out and some of the different therapies that we then, I feel like that's the solution to something, but the mental health piece is the prevention. And so if we can prevent that and save $14 billion and all of these cyclical issues and things in society that occur thereafter, then it's just huge. So if programs are able to get funding for doing maternal mental health, then they'll focus on that, right? So if you get the funding for it, you can focus on that and you can prevent all of these things long term instead of kind of chasing it after.
I agree with you. I think the cost is actually probably a lot more, and I love the fact that you mentioned about prevention. Obviously, we're appreciative of our donors. We need money. We need people to advocate for us. We need to hopefully expand these services, not just in California or in San Diego, but in every city in this country of ours, because as you mentioned earlier, the numbers of patients who are struggling with maternal mental health disorder is unfortunately very high. I want everyone to remember it's the number one underdiagnosed disease in pregnancy, and we're not addressing it well enough. So please get involved. Sheila, anything else you want to mention?
I just want people to know that it's not just being tearful, or it's not just feeling like you can't get out of bed. There's irritability, there's anxiety, there's OCD, there's PTSD that can come in. So there's a wide range, hence now the terms perinatal mood and anxiety disorders or maternal mental health as a big umbrella, because I think people wait or don't seek help because they feel like maybe they don't rise to the level of needing it. But it's such a shame, because if you're already feeling some of these symptoms of irritability, just lack of self-worth and self-confidence, which I think is so easy for a mom, even an experienced mom, somebody with higher education, all of us are at risk for this, and then that increases the risk of the dads or the other partner, or the non-birthing partner, to have mental health issues as well, and then the children, right? So it just keeps, it's kind of like a pebble in a pond. That ripple effect is just exponential. And so I think if people know, it doesn't mean you're a bad mom. It doesn't mean you did anything wrong. It's just part of the combination of a ridiculous amount of hormones coming through your body, the previous trauma you may have had, and then, lots of different situational aspects, but it's not your fault and it's preventable. I think people don't remember that this is 100% preventable, and you can get help and it's okay.
I think, a lot of times, women feel pressured because it's a happy time. They just had a baby and you're supposed to be happy, and there's no reason you should be depressed. But, again, we need to break the bubble that people are living in and, expecting everyone's going to be happy, and we need to address the issue. And I think a lot of this is preventable, as you mentioned. And we can also, again, how do we make sure that we create a very healthy life for our future, for our children? Mama's got to be well. One last thing I just want to tell you, as you mentioned again, mom. Miracle Babies, the name is Miracle Babies, but it's really about the mother. We want to make sure mom makes it to the NICU, to the ICU, to be with that child. If mom is not there, that child doesn't do well. We want to make sure that mom is mentally feeling well again, so she can be there with her child or children. So thank you for mentioning that again. And thank you for being part of this team. I appreciate you. Obviously, this is an organization that I'm very passionate about. And I think, when I walked in and I see your energy and I see that, the team members' energy in here, it's a reminder to me that we're doing some good work, because all of you are you're not doing this just as a job. This is a profession and you have a passion for it. And I hope to have, many more people like you involved in this program, and you're the one who's going to be choosing them. But anyways, I look forward to the future, Sheila. I appreciate you very much.
Well, I'm just so thrilled that there's this opportunity that I could even come and be a part of, where we're offering free mental health services to moms in need and reducing those barriers for them.
Such an honor to be here with you today. Thank you for joining us. I look forward to seeing you in the future and having hopefully more of these discussions together.
Yes, thank you. And thank
Such
you
a
for
pleasure.
Finding funding to provide this for people.
Thank you for being here.
So needed.
Thank you so much.